Hello, Dr. Dixit. What precautions would you suggest for someone who has just undergone a cardiac bypass surgery?
Okay. Bypass surgery is nowadays a very common surgery, cardiac surgical procedure done all over the world. And a lot of people ask me this question: what precautions to take when they are discharged from the hospital at home? Now, there are a few guidelines which I will tell you. One of the most important thing we have to remember is that when we do a bypass surgery routinely in a normal and in a conventional way is we cut the breastbone here, which is called the sternum. And this sternum, after we cutting the bone, we reach the heart where we do the surgery. And after the surgery is over, then we close this bone that is cut, or we join them together with a wire, which we call it as a sternal wire. Now this bone takes about 3 months to heal, and that is what is the most important precaution we have to take, that for 3 months we should not have any injury to the chest at that point, and so that the healing takes place in a faster way. So that is one of the most important thing. The other precaution that you have to take is, normally what I advise my patients is that you stay indoors in your house for 2 weeks. Don't go out of the house for 2 weeks. After 2 weeks, you can venture out, go for a slow walk outside, maybe 10 minutes in the beginning, then increase it to 20 minutes and 30 minutes. So over a period of time, you have to keep on increasing your walking distance. The third thing that you will face is that some days will be better, some days will be worse. So you do not count your progress on hour-to-hour basis or on day-to-day basis. So today you may be fine, tomorrow you may feel low, and day after tomorrow again you will be fine. So you count your progress on week-to-week basis rather than on day-to-day basis. On the day when you are low, when you don't feel well, just lie down and take more rest. Some days you will feel a lot of pain. Normally you may not get pain, but suddenly you will get a very severe pain in the sternal area or in the chest area, because when we cut the bone we retract the chest, and most of the joints, ribs or these joints, they can become painful. So in such a case, whenever there is a pain, you need not suffer. You just take a painkiller which your doctor would have prescribed, eat something and take it. Don't take it on an empty stomach. The other important thing is that your blood pressure, your blood sugar and your lipids, all these things which are the risk factor for having caused the heart disease, they should be controlled. So you should take your medicines regularly so that your blood pressure is normal, and you should take insulin for a month for your diabetes or for a sugar control, because insulin helps in wound healing. We normally do not give oral medicines for at least a month for your diabetic treatment. Sutures can be removed after about, some advised to remove it after a week, or some about 10 days or 15 days. But these sutures have to be eventually taken off. And if you feel unwell, or if you have any other symptom, you always have to contact your local doctor, who will be the best guide. 90 to 97% of the time he will be able to help you out. But if he advise that to contact your surgeon who has operated, please do not hesitate. You can always call him or call the hospital where you are operated and seek relief or seek an advice for your pain or for any other thing. Driving should be done after the sternum is healed. So I normally advise them to drive their car or vehicle after 3 months, because it takes about 3 months for the sternum to heal. So these are some of the basic things. And the most important question asked most of the time is, what should we eat, which oil should we use, and other thing. Normally most of these patients are diabetic and hypertensive. My way of looking at things is that they have been eating for so many years, 60, 65 years or 50 years. Another 1 month is not going to make a difference, because if we put them on a diet restriction immediately after surgery, then the healing gets delayed. They do not eat well. That is, so the healing gets delayed, and that's why what I advise them is, I advise them, you eat what you were eating, except sweets. I tell them not to eat sweets to reduce the carbohydrate load, so that your sugars are under control. Rest all to take high proteins, and these will help him. After a month, then I refer them to a dietitian who puts them on a diet restriction. So these are basically few of the tips that we advise patients who have undergone a bypass surgery.